My name is John McKeon, and I'm the moderator of the Teradata Aprimo River community, Teradata Aprimo's largest customer community. You can connect with us at teradataRiver2.com. Today, I'd like to welcome Tia Sawhney, Director of Data Analytics and Research, Illinois Department of Healthcare and Family Services. This is actually Illinois' Medicaid plan, 2.8 million residents. Tia, welcome to the River.
Thank you.
A very interesting topic of discussion. Tia is speaking at the Partners Conference, and she is speaking on delivering useful healthcare while protecting privacy, a real challenge. Tia, what started your journey on trying to do your latest initiative around fulfilling some promises?
The challenge started about a year ago in that Illinois Medicaid plan is financially challenged, as are many Medicaid plans around the country. And we're looking for new ideas as to how to better manage care, better manage costs. And our director engaged in a series of community meetings and then announced that we would have an innovations project that would solicit innovations ideas from community partners, and that as part of that solicitation that we would give them data to allow them to better understand the care that we're providing today to the Medicaid recipients and the health of those Medicaid recipients. So she announced to the community via the community meetings and public websites and such that when we put out the solicitation that virtually any community entity who was interested in responding could also get data from us.
Well, that's a huge challenge, Tia. So what about time frames? What about templates? What about budgets? What were those particulars?
We had essentially 3 months to produce the data. We had no templates. We had nothing pre-developed. We had no templates, and we had no budget. And let me back up, and as I said earlier, we're financially challenged. There's also a state procurement process, which is rather burdensome, which meant even if we had the money to get any consulting services, etc., through the state procurement process, there was no time.
So in other words, a typical IT project.
Perhaps much too typical. So we had to find the resources internally. We also had the great fortune of, because we're doing work that's important to the state of Illinois, Chicago has some healthcare foundations that were very interested in what we were doing, and they came to us, which was very fortunate, and said, what can we do to help? And upon reflection, we realized that one of the gaps we had is that whereas we did have data analytics people, we didn't have a writer. And a writer is very, very important because you cannot deliver new data to organizations that have never seen the data or even similar data before and expect them to understand it unless you wrap words around it. So we needed someone who could do two things. One is produce copious amounts of documentation regarding the data that we were delivering, what it is, what it means, how to best use it, etc. And the second would be to actually facilitate the data delivery. So the foundations very kindly provided us funding for that technical writer and customer service person.
So Tia, how did you come up with the really crystal clear vision on how to execute this?
What we did is we had a JAD, a Joint Application Development Session. We sat in a room and we designed the data that we wanted to deliver. And we did it in tiers. So we started out by designing, if the potential partners could have nothing else, what would be the most important perspectives on the data that they could have. One would be a person-centric perspective, and the other would be a provider-centric perspective. So we literally designed two tables, a Medicaid recipient table and a Medicaid provider table. And then we said, if people want to know more, what would they want to know? And that would be drill downs on some elements of those tables. And then what we did is we went to work to produce the data tables in that ordering. So starting out with the recipient and then the provider and then the drill downs. And we released the data in stages. What was really, really important to us and that allowed this project to work and work on the tight time frame was to have a very clear conceptualization of exactly what we were going to deliver. and then to manage the entire process to that delivery.
Tia, so big promises, big project, a lot of challenges. What were the outcomes? Were the clients at the end of the day happy?
We had great success. We were able to deliver the initial set of data tables on time with documentation. In fact, much of the documentation was available a week or so in advance of the delivery, including more than 100 frequently asked questions that we had written up in advance, and a data dictionary and a data glossary. We did not know how many potential community partners would request the data. We were thinking maybe there would be 20. In fact, there were more than 60 partners. We delivered it on what we called a mass customized basis, in that everyone got the same data elements, but they got to specify their population of interest. So if a potential partner was only interested in the people residing in a particular county, or the people in a particular county served by a particular provider, or the people in a county who had a particular disease, we could produce data with respect to that population. Other potential partners wanted data for the entire state. Each partner got to specify one or two, but no more than two populations of interest. And it worked, and we served more than 60 partners with one or two data sets each.
Tia, you did a lot of groundwork, a lot of good data work. Were there any surprises or ancillary benefits that came out of this?
Absolutely. Our primary goal, of course, was to meet the data needs of our potential partners. And we did that, but there were other fantastic outcomes. One is we produced data that was very, very easy to understand and consume. And what we found was it was likewise easy to understand and consume internally. Using the data, I and others can now answer questions in literally minutes that used to take us days or longer to answer, because we now have this highly structured data to refer to. The other thing that it helped with considerably was that we had legislation that had been passed, state legislation requiring us to post data publicly to meet transparency requirements. So we took a subset of the data and used it to satisfy that legislative mandate.
Tia Sawhney, Director of Data Analytics and Research, Illinois Department of Health and Family Services, the Illinois Medicaid plan. She will be speaking at Partners. It should be a great presentation if you are interested in this subject, and also how to do data with great privacy. You need to come hear Tia talk. Tia, look forward to seeing you at Partners.
Thank you so much.